But yeah, I'm happy to be here and happy to address the youth in our community as well as their parents. Of course, we're in a complete unique situation right now, unprecedented times with the coronavirus, and it's causing broad impacts in terms of economy and in terms of health. So I wanted to, talk specifically to some of the teens that are listening in, because I know this is a really rough time for you guys. Everything from the way that you are learning, which I know for a lot of teens is moving towards online learning, and even online learning takes so many various platforms between Zoom meetings or Google Classroom or Google Meet. Some of the teens that are listening on are doing synchronous learning or asynchronous learning. The amount of hours that they're spending on online learning is really variable. Some schools are offering grades, some are doing pass-fail. So in terms of the academic portion of things, just, everything's been turned upside down, and, of course, that can create a lot of stress and anxiety. There's a lot of uncertainty that's happening right now because of all of that. So, academically, I know that the youth are going through a lot right now. In terms of social issues, this is a really tough time for youth as well. It's important for us to remember that during the teenage years, social relationships are really important. Peer relationships are very important. It's very normal for teenagers to worry and care more about what their friends think than what their parents think. And this is a really rough time in that regard too, because social distancing and shelter in place. I know that the teens are not able to meet their friends the way they used to, and that can be a really tough thing to do, especially when a lot of teens do look for support from their friends when they're going through tough times like we're going through right now. And then the third thing is in terms of extracurriculars. I know a lot of the people that are listening in do a lot of things outside of academics, which we know is a really healthy thing to do. So it's really hard when you can't play the sport that you would like to, that you love to play, and you can't meet your teammates as you're playing sports, or if you're doing theater or drama, or community service, robotics, all the different things that youth are doing today, that's all been cut off. And so that's really tough too. So again, it's a really tough time that the youth are going through, so that's why I think it's important that we have platforms like this in which we can try to support our youth and help them as well as their parents navigate through this time. So as I talk about issues related to youth during this COVID-19 pandemic, just kind of overall, what I'd like to start off by doing is talking a little bit about the epidemiology of this virus, which of course we know is changing literally on an hour-to-hour basis. Talk a little bit about the science of this virus, and then move on to offering some tips to parents in case there are some parents listening as well, because, of course, as I said, this is a really tough time for kids, but it's a tough time for the parents as well, who are working from home and grappling with how to take care of their kids and trying to keep them on a routine and worried about how much they're on their technology. So I'll have some tips for parents, but then also some tips for all of the teens that are listening in terms of trying to get through this in a more healthy way. We're just gonna take a look at some information. So what is it that we're talking about? I just wanna kind of define that a little bit. So everyone talks about coronavirus. Well, let's keep in mind that coronavirus, there's many different types of coronavirus. In fact, coronavirus is one of the leading causes of the common cold. So it is important for us to just, define what this is. This is specifically SARS-CoV-2. That stands for Severe Acute Respiratory Syndrome. And then CoV is short for coronavirus 2. So some of the teens may not remember this, but at the beginning of the decade, it was our first SARS coronavirus, which started in Hong Kong. And then later on this decade, we had the MERS virus, Middle Eastern Respiratory Syndrome virus. And now we have this SARS-CoV-2. So, specifically, that's what we're talking about. So as I said, in terms of the epidemiology of this virus, and I put these numbers in as of yesterday. The numbers have changed even today. Of course, this is devastating. There's been over 1 million cases of people that have been confirmed to be infected with SARS-CoV-2 worldwide. It's a global pandemic affecting over 140 countries. And again, as of yesterday, almost 600,000 confirmed cases in the United States alone. Of course, this is making us have the dubious distinction of being the country that has the most number of infected people with SARS-CoV-2. And of course, the saddest part about this, right, is the fact that there's significant morbidity and mortality associated with this. Over 20,000 fatalities in the US alone due to SARS-CoV-2. Now, keep in mind that the mortality rate, which we think is 1 to 2%, is probably actually not that high. And the reason for that is because we don't know all the people that have actually been infected with this virus. The only people that we know that are infected are the ones that get tested. And there's a huge number of people that have this infection that have never been tested, partially because it's been really hard to get testing out. We've had very little testing available. So as healthcare providers, we're really trying to prioritize the people who really need the test the most. So again, there's magnitudes of people that are infected with this virus that we don't know about. And for that reason, again, the denominator changes, so the mortality rate's actually probably not as high. It might be a little bit closer to 0.7%. Now, this compares to influenza virus, which is causes much lower mortality rates. But again, that's kind of based on epidemiology and data, and our data about SARS-CoV-2 is not exact. But with influenza virus, the mortality rate's at 0.1%. Now, another point that I did want to make is that, as I mentioned, there's close to 24,000 fatalities from SARS-CoV-2. I just saw an article that came out today that indicated that the number of deaths due to influenza this year in the 2019 to 2020 cycle was 24,000. So 24,000 people died of influenza infection this past influenza season. And I'm not at all saying that influenza and SARS-CoV-2 are the same. We have a vaccine for influenza, which we do not for SARS-CoV-2. The transmissibility is probably different for SARS-CoV-2. The testing is much more robust and available for influenza. So again, I'm not saying these are the same viruses at all, but I do want to just remind all the listeners out there that influenza is a deadly virus, and just a plug for everybody to try to get the flu vaccine every year. So going on to the symptoms of SARS-CoV-2, and I think a lot of the audience is, I'm sure, familiar with this, but it's good to just review. Of course, the most common symptom that we tend to see is fever. This is a respiratory virus, so of course we tend to see cough. And then a smaller subset of people show shortness of breath and fatigue. Again, this is a novel virus. We're learning about it more and more every day. And so we're realizing now that some people do actually have GI symptoms, gastrointestinal symptoms. Loss of smell seems to be one of the other symptoms that some people have. So, again, we're learning more and more about the virus, but, fever and cough, shortness of breath are kind of the primary symptoms that we look for. Interestingly, again, this talk is kind of specifically related to kids and SARS-CoV-2. Kids, as I'll talk about later, tend to have milder infection or be asymptomatic when they get this infection. And interestingly, they do also tend to have lower rates of fever and cough as compared to adults. So again, just talking a little bit about disease severity, luckily the majority of people that get infected with SARS-CoV-2 have mild symptoms. So, of course, we think about the really sad cases of fatality, and those are there. That's affected thousands of people. But keep in mind that the majority of people that get this infection will have mild disease. A smaller subset, about 15%, will have severe disease, and then a small, about 5% of people will actually be sick enough to get hospitalized. Now, the people that get hospitalized are generally people that have other risk factors. We know that this tends to be a virus that causes more serious infection in the elderly, especially in those that are over 65 years old, or in people that have what's called pre-existing medical conditions, including hypertension, just a fancy medical word for high blood pressure, COPD, which stands for chronic obstructive pulmonary disease, or diabetes, or people that are immunocompromised, such as people who have gone through chemotherapy or are on some drugs for autoimmune diseases. Why is it that kids seem to not get as significantly affected with this virus? We're not exactly sure. Scientists are exploring several theories about why children seem to be relatively protected from getting severe disease from SARS-CoV-2. And one of the leading ideas is that there's a receptor in human cells that the viral particles attach to It's called the ACE2 receptor, and it seems like this may not be as prominently expressed in young children, or it may be a different shape. So, again, we're learning more about this virus, but perhaps that's the reason that this virus doesn't tend to affect, kids as often as it does adults. Another thought actually is that the kids in general, their immune system doesn't respond as aggressively necessarily to viral infections as an adult immune system, because the kid's immune system is not as robust, and it's possible that for that reason, maybe the virus just doesn't get a chance to replicate and cause as much damage. Interestingly, we know that about 28% of cases of kids who get a coronavirus infection, as we're getting more and more data on this, are actually asymptomatic. And that's a really important point that I'd like to make to all the youth that are listening to this right now, is that that's considered to be one of the reasons that this virus is different than other coronaviruses, such as the first SARS virus or the MERS virus, in terms of why is this virus so much harder to contain. And part of the reason for that, the thinking is that kids are oftentimes asymptomatic and may not know that they have the infection, and then are passing it to other people. So shout out to all the teens that are listening to please practice social distancing. Even though we know that kids don't tend to get significantly ill from this infection as their adult counterparts, they're more likely to be asymptomatic and pass on the infection. So again, please practice that social distancing. But again, the numbers look much better for kids. We know that less than 1% of patients who have been hospitalized are under 19 years of age. Now, if you look specifically at the kids that have been hospitalized, it's usually the babies. So kids under 1 year of age are the ones that are more likely to get hospitalized, especially if they have, again, pre-existing medical conditions, such as being born premature or lung conditions or things like that. Another issue, of course, related to pediatrics is newborn babies. So again, we're learning more and more about this virus, but from what we know so far, it seems that a vertical transmission from mom to baby is not thought to happen. Cases of kids so far who were born to moms who were tested positive for COVID-19 do not necessarily get the infection. And it is also not thought to be passed through breast milk. So the current recommendation is that if a baby is born to a mother who is tested positive for COVID-19, they should be physically separated from them so that the child does not get infected, but the mom can continue to pump and give breast milk to the baby. So again, I wanted to talk a little bit about some tips, completely shifting gears now, just to the parents that are listening about what they can do at home. Again, these are kind of very different times. We have a different reality that we're living in right now. So what is it that parents can do at home? And this is geared a little bit more towards parents that have like the little ones at home to try to just keep the home calm. So one of the things is to try to prevent boredom. We know that bored or frustrated kids are more likely to act out. We know that kids have had their lives significantly disrupted. They're out of school, they can't play with their friends. So it is important to try to keep kids busy, with a healthy and productive schedule. Number two is address fears. These are scary times that we're going through right now. Again, lots of things that can cause a lot of anxiety. Kids might see their parents nervous and worried. Of course, they're seeing news reports, they're hearing about people dying. So it's important to talk through these things with your kids, have discussions about them, find out what their fears are, what their thoughts are, maybe dispel some myths that they have or uncertainties that they have. Number three is using timeouts. And again, this is obviously not for our teens, but for our younger kids. And the important thing with timeouts that I always tell parents in clinic is that this is not really something that you want to do necessarily in a punitive way, but it's more just that if a child is having a behavior that is not the right behavior, that they need to get a timeout from the behavior and the parent needs to get a timeout from them. So it's more just about putting a child into an area where they can't hurt themselves or hurt you, letting them vent, and then afterwards, that's a time just to kind of talk about why you needed to put them in the timeout. Kind of related to that is to redirect bad behavior. Sometimes kids just misbehave because they don't know any better. And, when things like that happen, things like distraction and just trying to kind of like get them onto something else is a good thing to do. Sometimes it's good just to not respond. If a child is doing something and it's not really going to end up hurting them or hurting other people, ignoring bad behavior can be an effective way of stopping it. So it's just another tool that parents can have available to them. At the same time, we want to praise success. That's what we call positive discipline. It's a really important aspect of parenting. all too often as parents, we're calling out our kids when they're doing something that we don't want them to do, but it's important to praise them when they are doing things that are helpful. Allowing time for attention. This is a tough one because parents are at home now and they're working from home, and sometimes kids are looking for our attention. We may not be able to give it to them, but even carving out just a few minutes every day to try to give some attention to kids is great. And of course, I hope this goes without saying, but you really want to try to avoid any kind of physical punishment. We know from lots and lots of data and research that it's not effective, and you're not role modeling good behavior if you do that kind of stuff. If you are aggressive to your child, you're basically validating aggression for them. And then lastly, take care of yourself. This is kind of like the oxygen mask on the airplane thing. You got to breathe before you can help your kid breathe. So just to make sure that, you are taking care of yourself and staying in a healthy place so you can be effective. So I want to talk now specifically to all the teens that are out there listening about what is it that you can do to kind of navigate through this tough time. I'd say probably one of the most important things that if you can is to stick to a schedule. It's really hard right now because, again, everything's topsy-turvy. You're not, waking up in the morning, getting ready, going to school, doing your extracurriculars, coming home, having dinner, studying. Everything is just, all different. So if you can, though, continue to try to stick to a schedule that works with your online learning. So set a specific time to wake up. Try to make sure you have some time to exercise every day. Take your shower, get dressed just like you would if you were going to school. Eat your breakfast. So just really try to keep a routine. If it helps, do allow yourself to sleep in a little later than you normally would. This is a good opportunity for that. But otherwise try to stick to a routine. And just like you would if you were in school, try to keep your phone off while you're doing your homework. Try to keep the TV off during school hours. And just plan mini breaks. Make sure you give yourself time for lunch. But I think having a routine is one of the most important things. The second thing I want to say is just about dinner. I think one of the times of day that I always really look forward to is coming home and having family meal time so I can check in with my wife and 2 kids and see how everything's going. So I think, it is a good opportunity now that parents are working at home and that kids are not necessarily busy doing extracurriculars to actually have meal times together. I think it's a really important way to support ourselves through all this. The next thing is allowing yourself for some downtime. So it is really normal for teenagers to crave privacy from their parents. That's a normal developmental thing that we see happening during the teenage years. So I'd say to the teenagers out there, give yourself some time for some quiet time, some reflective time, some creative time. Listen to music. And I do think to parents, it's really important to allow our kids the time to have the abilities, the time to connect with their friends. Again, social relationships are really important for kids, and it's important for them to be able to continue to have those connections to support them to get through this. The next thing is just share information about what's happening, especially for the teens who are really savvy, smart. We're all getting a lot of information every day about coronavirus, but I think it's important to just talk about it. What is the data showing, and what are the newest results, and what are we learning about this virus? Because I think it's always important to be educated and informed. As I said before, would really encourage the teens out there, the youth, to remember that social distancing is really important. The elderly are really at risk right now, so one of the best things we can do to keep parents, grandparents, all the elderly safe and hopefully out of the hospital is to practice that social distancing. And then, as I said, reach out virtually. As I mentioned, it's important to kind of keep those social connections going. So I have a teenage daughter at home myself. She's 16 years old, and I have an 11-year-old daughter. So we've talked about how this is a really rough time. But at the same time, I think there's some opportunities that are available. There is definitely more downtime right now. So I think it's a good chance to just kind of try to develop a healthy body and healthy mind. So one of the things that my 2 kids have been really great about doing is really helping out with some household chores. And, I think that all too often we're so focused on academics, but there's a lot of really important life skills, or what I call kind of adulting skills, that I think that the youth have an opportunity to really get a chance to finally learn. Maybe this would be a good time for you to learn how to cook some simple meals so that when you go off to college, if you're staying in an apartment and not in a dorm, you can actually do some cooking for yourself. Maybe this is a good time to actually learn how to do laundry, which you're going to have to do when you head off to college, or learn how to put the fitted sheets on your bed, and all that kind of stuff. So just helping out with household chores. And I think one of the things that's important with that is it's important, I feel as a father, for everyone in a family to realize that this is a tough time and it's really important for us to support each other and to feel like as a family that you are working together to get through this. And I think helping out with household chores is an important part of that. Another thing that I would really encourage all the teens out there to do is to exercise. Lots and lots of research has shown that exercise is a way to make not only your body feel good, but also your mind feel good. You're releasing endorphins when you exercise. So, really encourage the teens to try to find some time to exercise every day. Again, with social distancing, I know you can't get out there on the basketball court or soccer field, but there's a lot of online things that you can find to do at home. And, of course, going for a walk in the neighborhood, as long as you are practicing social distancing, it's great to do. Kind of related to exercises, meditation and yoga. So, again, we're learning more and more about all the benefits of things like meditation. So, maybe this is an opportunity to actually pick up a meditation practice. I think it's really important, especially in situations like this, where there is a lot of potential for stress and anxiety and confusion, to be able to find some time to do some meditation or to develop a meditation practice. I know when I see teenagers in my clinic, I refer them to some really great apps that are available to learn meditation. So one is called Headspace, one is called Calm, so you can check those out. And the great thing about an app is that you can do it on your own time, whenever you want it, wherever you want it. A lot of those apps have even like a 5-minute meditation that you can do. So good chance to learn that kind of stuff, make it part of your daily routine, hopefully, even if it's a few minutes. And then again, a lot of research is showing that the benefits of yoga, it's really great, of course, in terms of flexibility and spinal alignment, but it is actually a really good way to just de-stress. Does help in terms of anxiety. So again, lots of great online opportunities for things like yoga. I know a lot of the teens that I see in my clinic are so busy with schoolwork and extracurriculars that they don't really get a time to explore other things, but maybe this is a good time to pick up a new hobby. If there's something that you've been kind of thinking about doing but have never really gotten a chance to do it, maybe this is a great time to do that. Or on the other hand, there's something that you've been really into and just never have time to really kind of dive deep and learn more, whether it's doing some stuff online or watching documentaries or things like that. This would be a great opportunity. I know a lot of the teens that I see in my clinic are sleep deprived. They're not getting enough sleep. They're busy doing homework and extracurriculars and trying to get those good grades, trying to get into a good college, and sleep gets sacrificed. But this is an opportunity, I think, to really try to make sure that you get a good amount of sleep. We recommend that teenagers get hopefully 8 to 9 hours of sleep per night. And one of the things I really emphasize when I see teens in clinic is it's not just the number of hours of sleep that you're getting, but the quality of sleep that you're getting that's important. And the quality of sleep is directly tied into when you go to sleep, because more of your deep sleep cycles occur earlier in the night. So if you go to sleep too late, even if you're sleeping for 9 or 10 hours, let's say you sleep at 1 o'clock in the morning, you're just not getting as much of that good, deep, rich sleep. So try to get to sleep on time, hopefully not later than about 10:30 or 11 or so. Try to get good 8 to 9 hours of sleep. And then lastly, this is a good opportunity. I know I've been doing a lot of this myself, is just to go through stuff, go through your closets, go through your drawers, find out, what you really need, what you don't need, get your desk, really kind of nice and organized, and a great opportunity to maybe realize that there's some things that you have that you don't need, and we can donate those things to people that are less fortunate. So in closing, I would just say this is a great opportunity to practice gratitude. We know from a lot of research that people that practice gratitude are happier, and the people around them are happier. So, maybe a good opportunity to keep a gratitude journal on your bedside. So, again, research has shown that if every night before you go to sleep, you write down 3, 4, or 5 things that you're grateful for, and you do that on a regular basis, that really does help in terms of your overall happiness. But, these are uncertain times. I would say at this point, if you're lucky enough to have food, and if you're lucky enough to have shelter, and you're living and breathing, I think really more than academic success, that's what defines success right now.